welcome back to our SESI Talks. Today we are here with Dr. Simona Guaiardo, which is a policy analyst for the European Policy Centers. SESI Talks, as you know, is part of our WEEP, Workers and the European Parliament project. We want to bring to citizens and workers the activities of the European Parliament, especially during this difficult time. Today, our topic focuses on the health sector and especially on digitalization. Obviously, we know that the health workforce at this moment in time has been highly impacted by the pandemic, obviously. But today, we really want to talk about what is going on in the future, obviously, of the healthcare. So we talk about digitalization. So we wanted to ask you the new trends and opportunities and challenges that we're going to face so far in the health department.
So, well, Sarah, thank you very much. It's a pleasure for me to be here. So, as we know, our society and economy, they are experiencing a vast digital transformation. This transformation touches upon many sectors, really, and of course, health is no exception. Some of the trends we have seen in recent years include telemedicine, for example, teleconsultations, the digital delivery of health services, electronic health records, e-prescriptions, the use of big data analytics for research. So the use of digital tools in health is becoming increasingly prominent. The COVID-19 crisis has just underscored the importance of the digital transformation in health, and to some extent, I think it has also accelerated it. So in terms of benefits, digital innovation, I think, in health, I think brings about different potential benefits and opportunities for the different actors involved. Digital tools applied in health can, for example, facilitate inclusion. They can help deliver more patient-centered care. They can enhance access to services, access to information. They can empower citizens, they can empower patients, and they can also contribute to make health systems more effective and fiscally more sustainable. But let's look at the challenges. I think it is extremely important not to ignore what the challenges are, challenges that come with digitalization in health. I think that to fully reap the benefits of digitalization, it is crucial to make it inclusive, to make sure that no one is left behind, and that this digital transition, does not create new inequalities. Some of the challenges, I think, include the uneven development of ICT infrastructure, for example, ICT infrastructure across and within countries, but also the digital divide, low uptake of digital solutions, digital illiteracy, and acceptance and trust. These are all fundamental elements that need to be addressed if digitalization in health is to be inclusive and is to be effective.
And on that, because obviously if we want digitalization to be inclusive and effective, we know that it should be moving sort of at the same pace pretty much everywhere, this is one of the big challenges that I think we're all facing within countries of the European Union and within regions of each country. But what will be the actual impact on workers and on the health workforce?
Well, I think digitalization has the potential to create a significant number of disruptive changes in the labor market. On the one hand, the digital revolution and automation can have destructive effects on jobs. But on the other hand, on the bright side, digital innovation has the potential of creating new jobs that did not exist. So it is really difficult to assess whether job destruction and job creation generated by technological advancements will compensate one another. But surely this wave of innovation is going to cause job displacement in the labor market and will alter the existing structure of the labor market. If we think about the health workforce, there are studies that analyze the propensity of jobs to be affected by automation, by computerization. According to these studies, it seems that most occupations in the sector of health and care are less likely to be affected by automation soon, at least in the coming years, as compared to other sectors in the economy. So, for example, professionals such as surgeons, physicians, nurses, but also social workers and other related jobs, those are expected to be less affected by the risk of job loss, which can be caused by automation. However, and I think this is very important to mention, workers employed in the field of health are more likely to experience changing skills profiles due to the increasing deployment of digital solutions in the sector. In addition to that, in addition to the transformative impact on specific tasks and the required skills, I think that new technologies also affect how health services are delivered. So new delivery models enabled by digital solutions would require health professionals to adjust to these models, to adjust their working patterns. For example, the development of integrated care models or the enhanced co-production of health, so with a higher engagement from patients. These models, all of these will require the workforce, the health workforce, to adjust to new ways of working and to new ways of delivering care and health services. So the digital transition in health and these effects, these transformative effects, I think they point towards the need to spread digital skills, to adjust to changing working patterns, and to consider maybe new ways to deliver care and to get equipped for these new ways.
Absolutely, and I think on the point of what you just said right now, and it's something that us as trade unions want to focus on as well, the huge importance of training and long life learning of these new skills, I think becomes key in this moment in times. And regarding to this, what would be the role of the European Union and in particular the European Parliament on these issues overall and more in general, or what has been done so far and what is it planning to do?
Well, digital health and all of its consequences, I think it has been high on the EU agenda for quite some time now. Over a decade, I would say. Over the years, the Commission has adopted a number of strategies and action plans in this field, mainly to support member states and to foster digital health. And the European Parliament has also underlined some key issues, some key elements which are necessary to enable the digital transformation of health and care and to make it inclusive, as I mentioned. Among these, the need to address data privacy and security concerns, and also the absolute importance of taking into account patients' needs when designing and using digital health solutions. I think it is important to mention that digitalization is one of the 6 priorities of the Commission when they were designed in 2019. In this context, the digital transformation of health and care represents one key element of the digital single market strategy. And on top of that, the digital transition, together with its twin green transition, is now a pillar of the recovery strategy of Europe the recovery from the COVID-19 crisis. So the role of the EU is to provide policy guidance in this field, but besides that, digital health also receives significant attention in terms of funding instruments. So in addition to the structural funds, the European Social Fund Plus, there is an increasing level of funding dedicated to digital health. I can think of the new Horizon program, the Digital Europe program, the new health program, EU4Health, and of course the resiliency and recovery, the recovery and resilience facility. So going forward, I think it is also important to mention that the EU institutions will work on a number of issues, including the European Health Data Space, to make it a reality, to promote safe exchange of patients' data, and to foster research and innovation in this field.
Well, Ms. Guajardo, thank you very much for your input, and hopefully we will update again later on in time to see what is going on and how digitalization is going to transform the pretty much everywhere, each sector, not just the health sector. So thank you very much again, and thank you everyone for listening. See you soon.
Thank you. It's been a pleasure.